What is little leaguer's shoulder and what can we do about it? That's the topic that we're going to cover in this video. Welcome back to Overhead Athletics. I'm Max Wardell, and we're going to talk about little leaguer's shoulder. Something that we hear all the time is little leaguer's elbow. And little leaguer's elbow is a really common pathology that we see in our throwing athletes, but little leaguer's shoulder is like that cousin. So they're both at the party, they're both at the family reunion, but the little leaguer's elbow is out there and he's playing and he's making a ruckus and maybe he damages something. Well, little leaguer's shoulder is kind of like that sneaky cousin that's going around and maybe he's tripping people and doing things like that. He's causing just as much of a problem, but he's not as noticed. And that's because when we talk about little leaguer's shoulder and little leaguer's elbow, we see a ton of little leaguer's shoulder, not quite as much as little leaguer's elbow, but it's kind of going under the radar. So we wanted to put together a video today, kind of talk about what it is and then some of the things that we actually do for it in the clinical setting. So essentially what little leaguer's shoulder is a separation of the growth plate. We can have a separation of the growth plate on the inside of the arm and actually get little leaguer's elbow, but we can also get it up here in the shoulder. And we got to think there's a lot of things going on. A repetitive overuse injury occurs when we put our joints in poor positions and we continually load them. So we can get an impingement syndrome where there's a pinching at the top. We can also get a excessive pulling by the rotator cuff and some of the other intricate muscles around the shoulder that are pulling super hard because the position that the shoulder's placed in. So if it's put in the wrong position during the throw, those muscles are going to have to work harder than they otherwise would. We know that when we look at EMG profiles of amateur athletes versus professional athletes, percentage-wise, the professional athletes use their rotator cuff at a lot lower level than the younger athletes, the amateur athletes, and the injured athletes who use their rotator cuff like crazy throughout the duration of the throw. These are contributing factors to that separation of the growth plate in the shoulder, which we call little leaguer's shoulder in our young throwers. Some of the things that you need to do. First, you need to see an orthopedic physician. If you suspect this or you're having chronic pain, your 10, 12, 14-year-old son is having chronic shoulder pain, you're going to need to get them checked out because the longer that goes on, the greater the chance of permanent damage to the shoulder joint. We see those all the time. Sometimes we see athletes who've had shoulder pain for 4 years and they're only 16. Look at their shoulder and the way it moves and how it actually moves during the throw are totally off. We send them into one of our orthopedic surgeons that we work with and they look at the radiograph and they say, wow, there's a lot of damage here. So we got to avoid that. If you're just starting to experience shoulder pain, or little leaguer's shoulder, you got to make sure you're doing things the right way. So we got to make sure we're resting. We're shutting down throwing. It's got to recover. That bone actually has to start to heal back together and the growth plate has to heal. In addition to that, if you have little leaguer's shoulder and there's a growth plate injury, often there's injuries with other soft tissues and other muscular structures in the area. So those things have to have time to heal. We got to get your rotator cuff strong. We got to get your scapulas to move the right way. We got to get the rest of your body moving the right way. And then ultimately, we got to get you to throw the right way. So the first step is rest and then to start to introduce some exercises that can be tolerated. I'm going to show you 2 exercises that we do all the time, but you got to make sure that you're actually cleared to start to do any shoulder exercise to begin with. If you've done a lot of damage to your shoulder, you're going to need to rest and consult with your orthopedic surgeon or orthopedic physical therapist before you just start arbitrarily applying exercises. What I'm going to do is I'm going to show you 2 of our favorite exercises that you can start to do if you're starting to have or starting to see some symptoms of shoulder injury or shoulder pain in your young thrower or anybody on your team. And these are also great preventative exercises. So let me grab a dumbbell and we'll get into those. So here we go. We got our dumbbell here. I advise if you got a young thrower, 10, 11 years old, start with a 1-pounder. If you're 13, or 12, let's go maybe 14, let's go 2 pounds. If you're older than that, you're having shoulder pain, you're watching this video, you could probably go 2 to 3 pounds, but I usually say start on the light side, start with endurance-based activity, and then build to a little bit more strength once you know that you can tolerate it. It's better to find out that, hey, this probably isn't great for me right now, or I'm not ready for this exercise if I have a 1-pound dumbbell rather than a 3. I'm going to show you the left arm. In this video, I show all of my stuff on the right because I'm right-handed, so I'm going to show you the left arm. So here are the exercises. A full can for somebody that's having shoulder pain. If you're not and you're using this as a preventive measure, I'm going to show you the empty can. That's something that you can progress to farther along in the rehab process. And I'm going to show you one laying on your side here on the bench. So first, what I'm going to do, I'm messed up because I wanted to lunge out with the other side because I'm right-handed. What I'm going to do is I'm going to go into a little lunge stance here, just a nice athletic stance. I'm closer to the position where I'd be if I was actually throwing. And from here, I've got to train one of the rotator cuff muscles called the supraspinatus. Now, I'm going to try to train 2 muscles at the same time, or it's going to be a little bit more than that, but I'm really focusing on 2 different muscles. I'm focusing on that supraspinatus, which is one of our rotator cuff muscles, and the serratus muscle, which comes under my armpit and helps control where my shoulder blade is on my rib cage. So here, I've got my thumb up, so it's like a full can. I'm holding the full can. And I've got my chest up, so I'm not rounding my chest. Now from here, I'm going to lift on a 45-degree angle, not out to the side directly, not out in front of me. 45-degree angle. My chest is forward just a little bit, and from here, I lift on a 45-degree angle, and I could just lift like this all day. Your athlete's going to start to want to do this. What you need to teach them to do is nice and controlled, reach as far as I can. So when I go up, I'm trying to reach out that way as far as I can. And what that's doing is that's turning on this other muscle, and it's seating the actual ball in the socket. So now I'm less likely to impinge it, which is what needs to happen during the throw. So now I'm reaching on the 45 up to here. If I get pinching up at the top, I don't go as high. I only go to here. I could start with just this little range of motion here and get a nice exercise for my rotator cuff. So I start here, and once I can tolerate this stuff and do it really well, I'll progress to more advanced exercise, but these are where I generally start. So thumb up, reach, 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 reach. Reach, reach, reach on the way up and the way down. I'm reaching out as far as I possibly can. Now, the empty can, which is if you're more advanced or you're not having shoulder pain, we're much farther along in the process, is the opposite. So the thumb is now down, and I'm doing the same thing. I'm reaching on a 45, and I don't go quite as high. I go a little bit lower than the shoulder, but I'm reaching out as far as I can, all the way up and all the way down, training the muscle in the positions it needs to be trained. That should be very difficult. If that exercise isn't difficult, then you're not doing it well enough. You got to make sure you're reaching as far as you possibly can, keeping your shoulder down. Don't let it shrug up. So the shoulder's down and I'm reaching. If after I do those, I go to my side lying exercise, which is for the rotator cuff here. What I like to do is I like to take a baseball glove. If you've got it, put it right under the armpit here. So it takes the arm a little bit away from the side. I bend the knees, and I've done a whole video on this exercise. In fact, so you can check that out on our channel here. But I'm going to roll my chest forward, and I can do this flat on the ground too. I'm going to keep my shoulder down towards my pocket and back. I'm pushing my tip of my elbow towards my pocket, and then I'm going to rotate up this way. So I see this done all the time like this. Okay, but I'm probably not training the rotator cuff the way it needs to be trained. So I roll forward. My chest is rolled towards the ground. I push my elbow towards my pocket, and I don't let my shoulder come forward so it comes back. So now, right there, and I do the exercise, and I hold it. I'm not moving back and forth. It's nice and easy. And you'll see all sorts of compensation here, and it's really easy to see if the technique is right. Do I see a perfect rotation, or do I see a deviation like this? Do I see them here, or do I see them there? If I see them there, I guess put them into the right spot and say, hold this position. So a lot of times that's all you need to do. Put them into the right spot, say, hold it here, now do it. But I really like having a baseball glove or a towel roll under the arm. It helps out technique a lot. And that's basically how we'll start in terms of exercise. And there's a lot we do later on. So if that's something you're looking to see, make sure to like the video. That lets us know that you want to see more on this topic. Let us know in the comments section. If there's something specifically that you're wondering about or you're interested in, let us know in the comments section, because I'm happy to put out more on little leaguer's elbow, little leaguer's shoulder, any injury that I see in my throwing population. And I want you guys to have quality information on the topic, because like I said, with little leaguer's shoulder, it goes neglected and not talked about. So subscribe to the channel so if we do come out with another video on the topic, you don't miss it. And if your son, your daughter has had little leaguer's shoulder and they're at the point where they can actually initiate a throwing program and they've been cleared to throw, the most important part, like I said in the beginning, is improving the way that they throw. They don't put their shoulder in positions that result in injury. And we've taken care of that for you. We got on our website, overheadathletics.com. We have return to throw progressions, which are relatively inexpensive, and they'll take you through 30 days where we look at percentage exertion, the number of throws, frequency of throwing, and how the athlete is actually throwing to get them to throw better. And we've also included a bunch of different exercise stuff for the rotator cuff and the shoulder in there as well. And that's on our website, overheadathletics.com. Check that out, and we'll see you in the next video.